Hello everybody, my name is Claire. Renee and I will be presenting links between culture and Aboriginal and Torres Strait Islander health. Ty and Fernanda will identify and explain relevant Aboriginal and Torres Strait Islander social determinants of health, such as health services, education, income, and personal health practices related to cardiovascular disease. We will all discuss on culturally competent and safe nursing practice as a registered nurse in relation to health disparities, focusing on cardiovascular disease in Aboriginal and Torres Strait Islander population in remote areas of Australia.
In this presentation, we will discuss the links between culture and Aboriginal and Torres Strait Islander health. We will identify and explain the relevant Aboriginal and Torres Strait Islanders' social determinants of health that impact on cardiovascular disease. And we will critically analyse how we would demonstrate culturally and safe care if we were registered nurses in this situation, in regards to disparities in health status and life expectancy of remote Aboriginal and Torres Strait Islanders' cardiovascular health.
The universal definition of health, according to the World Health Organization, states health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. However, Aboriginal and Torres Strait Islanders perceive health on a communal level rather than on an individual level. In saying this, Aboriginal and Torres Strait Islanders' health not only reflects individual physical well-being, but also incorporates the strength of their connection to their land and community. The differences in both definitions may be a contributing factor to the health gap that exists between the Indigenous and non-Indigenous population in Australia. According to the Australian Bureau of Statistics, Aboriginal and Torres Strait Islanders experience more illness and disabilities in comparison to the non-Indigenous population. Their life expectancy is projected to be 10.6 years lower than that of a non-Indigenous male and 9 years lower for females. While there are many campaigns such as Close the Gap campaign, health issues are still prevalent within the community. One of the possible reasons why this may be the trend is that health organisations and campaigns are still predominantly based on Anglo and Western beliefs. As mentioned above, Aboriginal and Torres Strait Islanders have strong ties to their land and community. Prior colonisation, Aboriginal healthcare consisted of traditional medical practices such as traditional healers, songs, and bush medicine. In contrast, Western medicine is commonly practiced and widely accepted. Such practices rely heavily on science-based evidence and originated from Western civilization. Whilst Aboriginal and Torres Strait Islanders' primary way of healthcare doesn't have a scientific backing, the Western medicine has, there are still rituals that have been practiced for years. Such practices may be overlooked and undermined because some may view it as less credible and therefore not effective. A study analysing the view of Aboriginal patients towards healthcare professionals in Western Australia further emphasises the contrasting views of health between Indigenous and non-Indigenous population. In the study, Aboriginal patients were interviewed, and various responses consisted of Aboriginal patients feeling that there was an apparent cultural barrier that healthcare physicians lacked understanding of. They viewed the healthcare system as cold, indifferent, and inflexible. So long as Aboriginal and Torres Strait Islanders have negative views on the healthcare system, we will continue to have adverse effects on Indigenous health within Australia. This can imply that strategies to combat cultural barriers such as incorporate Indigenous health beliefs to Western healthcare system may be effective in improving the Indigenous health in Australia.
Aboriginal and Torres Strait Islander people highly value their connection to the country, as they have strong spiritual connections to the land where they have traditional attachments and relationships. The strong connection to the land heavily influences the health of Aboriginal and Torres Strait Islander people, as their perspective to health and health care services are shaped by their cultural beliefs and the connection to the land. The connection to the country is a multifaceted term, where Aboriginal and Torres Strait Islander people incorporate the people, flora, fauna, the dreaming, soils, water, and the collective community. According to the report by Australian Institute of Aboriginal and Torres Strait Islander Studies, there was a study that reported that the Aboriginal people in the Murray River region were of poor physical and mental health, which was attributed by the poor health of the Murray River. The chairman of the Murray Lower Darling Rivers Indigenous Nations, Reen Woods, described the water as our lifeblood. It's just like our veins. He also shared, "The health of the river is disgraceful actually. It's not like when I first swam in the water." This emphasises that the lives of Aboriginal people in the Murray River was focused around the river, and that the connection to country is very significant to the health of Aboriginal and Torres Strait Islander people. As discussed, Aboriginal and Torres Strait Islander people define health as not just physical well-being, but mental, social, emotional and cultural well-being of not just an individual, but the whole community collectively. Working in connection with health services, nurses must understand this concept in order to provide patient-centred care for Aboriginal and Torres Strait Islander communities and individuals. The Australian Government National Aboriginal and Torres Strait Islander Health Plan 2013 to 2023 aims for an effective health system which delivers appropriate care that is culturally safe and accessible for all Aboriginal and Torres Strait Islander people. The report states that Aboriginal and Torres Strait Islander people access health services 1.1 times the rate of non-Indigenous Australians, although their needs are 2 to 3 times higher. This is because Aboriginal and Torres Strait Islander people have higher numbers of health problems than non-Indigenous people, but have less access of health services due to many factors, such as low health literacy, low income, and lack of transportation. The report aims to reduce inequalities by increasing accessibility to services, use of evidence-based practice, and decrease racism. Health services provided for Aboriginal and Torres Strait Islander people need to be in collaboration with the community to understand their cultural needs.
A person's health is influenced by a range of factors called social determinants of health. These include who they are, which are individual factors such as age, sex, genetic makeup, and what they do, which includes smoking, physical activity, alcohol, and diet. According to the World Health Organization, social determinants of health lie in the conditions in which people are born, grow, work, live in, and their age. Improving the health status by closing the gap in health disparities between Aboriginal and Torres Strait Islander communities and non-Aboriginal and Torres Strait Islander population in Australia is a long-last challenge for the government. It is critical to gain an understanding of the factors surrounding the gap in health status by analysing the social determinants of health. Cardiovascular disease is a collective term for diseases of the heart and blood vessels. The rate of cardiovascular disease and the prevalence of its risk factors is highest in remote areas in comparison to the Aboriginal and Torres Strait Islanders who live in regional and urban areas. The disparities in health status and life expectancy can be directly linked to the social determinants of health, specifically access to health services, education, income and social status, and personal health practices. According to the Heart Foundation, 14% of the recorded Aboriginal and Torres Strait Islander death was a result of heart disease, contributing to the gap in life expectancy between Indigenous and non-Indigenous Australians. The most prominent cardiovascular disease amongst the Indigenous Australian population include coronary heart disease, cerebrovascular disease, and hypertension. The Aboriginal and Torres Strait Islander community is 70% more likely to die from cardiovascular disease. Access to health services plays a major contributor in the health disparities relating to cardiovascular disease within the Indigenous Australian community. Factors which contribute include the lack of available or affordable transportation to health facilities and the general absence of health facilities. in remote communities. It is important to note the difficulty in seeking distant and medical expert advice within a safe time frame, with recent reports highlighting the low rate of coronary angiography and revascularization within the remote Aboriginal and Torres Strait Islander population, despite the very high burden of cardiovascular disease. This could be due to the limited knowledge of the signs and symptoms of cardiovascular disease. Therefore, due to the lack of proper education, cardiovascular disease is often left untreated until it becomes unbearable and possibly untreatable. The language barrier is a major educational factor which contributes to the health disparities, specifically within the remote Indigenous population, as English is likely to be a second language, resulting in communication barriers. The limited awareness and education of the risk-taking behaviours associated with cardiovascular disease predisposes an unhealthy lifestyle and personal health practices. 98% of Indigenous Australian adults living in remote communities do not meet the daily recommended intake for food and vegetables, compared to a national average of 94%. And although rates of smoking within the Aboriginal and Torres Strait Islander population has decreased, it is still higher in remote Indigenous communities. Roughly 70% of cardiovascular disease within the Indigenous Australian community is directly linked to modifiable personal health practices, including smoking and alcohol consumption, a sedentary lifestyle, obesity, high blood pressure, and high cholesterol. In general terms, these social determinants of health are a predisposition to income and social status. In this case, higher rates of poverty in remote and very remote areas, thus leading to an environment which stimulates the onset of health conditions like cardiovascular disease in the Aboriginal and Torres Strait Islander community compared to that of the Australians living in rural or urban communities.
Closing the gap has been a headline, it's been a slogan, but sadly we have not seen much delivered. Now, it's one thing to have the commitment and the will, and indeed the money that is spent every year as well, around $30 billion. $30 billion is spent each year on Indigenous welfare programs, to put it broadly, in Australia. And yet we are still seeing across every possible socio-economic indicator, whether it's health, housing, education, employment, whether it is infant mortality, whether it is having the lowest life expectancy in the country or the highest rates of incarceration, Indigenous people still suffer far more greatly than any other sector of the Australian population. And rheumatic heart disease is an extraordinary example of this. Here was a disease that was fairly widespread in the mainstream community across most populations, and now it is prevalent primarily amongst these small minority Indigenous populations. So what does that tell you? It tells you that people haven't had the awareness, they haven't had the education, they haven't had the access to healthcare to prevent what are entirely preventable diseases. So what does it tell us? It tells us that we need greater political clout. We need greater political involvement. We need Indigenous people in Australia to have access to education, to be able to gain the skills and the qualifications to go back to their communities and make a difference. We need to be able to look at a political process, a process of raising awareness and having buy-in from the Indigenous population here before we can really get around to tackling these crippling issues. Rheumatic heart disease stands out as a great example of this because they've been able to make a difference in New Zealand, because in the broader Australian population it was effectively eradicated, and yet in the Indigenous population it remains. So it stands as an extraordinary example in and of itself of just how much more needs to be done, not just in that area, but as a symbol of the broader challenges in Australia. When you are dealing with specific issues that really do affect the Indigenous community more than anyone else, and they are the issues of lack of access to resources, lack of education, lack of healthcare, often very remote communities as well. This presents yet another barrier, presents yet another obstacle. So you need to listen to the people, you need to hear what the people have to tell you, you need to involve the people themselves in the outcomes if you're really going to make a difference. All the money, all the goodwill, all the policy in the world is not going to make a difference unless you can bring the people with you. That's absolutely paramount.
Respect for Aboriginal and Torres Strait Islander perspective is fundamental for a registered nurse in demonstrating cultural competency and safe care for Indigenous remote communities battling cardiovascular disease. A lack of awareness of the signs and symptoms of cardiovascular disease and the appropriate interventions available can not only impact on the rate of diagnosis, but also on the modifiable risk-taking behaviours. Therefore, it is important for a nurse to develop a knowledge of some rites, rituals, and beliefs of other cultures, in this case the country in which the remote Aboriginal and Torres Strait Islander community identify with, in order to understand the thinking behind certain behaviours and to address misconceptions they may have regarding their health or the services being provided. Respect for Indigenous culture can also be achieved through effective communication. This is not limited to the language, but also encompasses appreciation of differences, demonstrating an understanding of cultural domains, and working in partnership with the community. It is also important to achieve cultural empathy through reflecting on one's own belief to avoid prejudices. In doing so, a registered nurse would be able to effectively work with the community to appropriately correct any misconceptions, promote health education, and achieve better health outcomes of the remote Indigenous community.
To address the disparity in health status and life expectancy for Aboriginal and Torres Strait Islander people who experience cardiovascular disease in remote areas, nurses must work in consultation and partnership with the Aboriginal and Torres Strait Islander community to provide culturally competent and safe nursing practice. According to Reconciliation Australia, cultural awareness consists of treating everyone as an individual, being aware of cultural differences, being skilled at difficult interactions, and showing respect. Being culturally aware as nurses is vital, as nurses work in settings with a diverse range of individuals with different cultural backgrounds. Working in consultation and partnership with the Aboriginal and Torres Strait Islander community can help nurses to gain a better understanding of remote communities and their perspective of cardiovascular disease. To work in partnership, it is important to get to know the Aboriginal and Torres Strait Islander community and to build a meaningful relationship of trust. Reconciliation Australia suggests acknowledging all the problems, understand cultural obligations, listen well, and demonstrate respect when working in partnerships. Henceforth, nurses that are culturally competent can provide safe practice by working in partnership with communities, by developing a healthy relationship with Aboriginal and Torres Strait Islander people.
Appropriate verbal and non-verbal communication is critical in achieving culturally competent and safe nursing practice in remote Aboriginal and Torres Strait Islander communities suffering from cardiovascular disease. Nurses who participate in a culturally safe matter are able to speak in a clear, gentle tone of voice, making sure not to speak too fast in order to avoid patient confusion and misunderstanding. In contrast, effective non-verbal communication skills include good posture and smiling. Personal space and listening skills are all forms of culturally safe nursing practice. However, nurses who do not communicate appropriately will not achieve the benefits of patient understanding of information, prevention, diagnosis, treatment, and management of their health. In this case, cardiovascular disease. Inappropriate non-verbal communication can lead to the patient feeling uncomfortable or threatened. resulting in a decrease in level of respect and reputation between the patient and the nurse.
Cultural education is paramount in achieving optimal and quality healthcare for the Aboriginal and Torres Strait Islander population. As nurses are essentially the patient's advocates, they must have a good relationship and clear understanding with all patients. As mentioned earlier, the Indigenous population currently has a negative view on the healthcare system. Being culturally aware and confronting the effects of racism will aid in eliminating health disparities that are present in the Indigenous population.
Appropriate verbal and non-verbal communication is critical in achieving culturally competent and safe nursing practice in remote Aboriginal and Torres Strait Islander communities suffering from cardiovascular disease. Nurses who participate in a culturally safe manner are able to speak in a clear, gentle tone of voice, making sure not to speak too fast in order to avoid patient confusion and misunderstanding. In contrast, effective non-verbal communication skills include good posture and smiling, personal space, and listening skills are all forms of culturally safe nursing practice. However, nurses who do not communicate appropriately will not achieve the benefits of patient understanding of information, prevention, diagnosis, treatment, and management of their health. In this case, cardiovascular disease. Inappropriate non-verbal communication can lead to the patient feeling uncomfortable or threatened, resulting in a decrease in level of respect and reputation between the patient and the nurse.